If you have ever felt a dull ache in your lower back after a big meal, or noticed your ankles puffing up a little more than usual by the end of the day, stay with me for the next few minutes, because what I am about to share could change the way you look at your plate forever. I am Dr. Bennett, and today we are talking about something almost nobody thinks about until it is too late. The slow, quiet strain that certain everyday foods can place on your kidneys. These are not exotic foods. They are not rare ingredients you have never heard of. In fact, there is a very good chance that at least 3 or 4 of the foods on this list are sitting in your kitchen right now, maybe even in your fridge or your pantry, within arm's reach as you watch this. By the end of this video, you will know exactly which foods to watch, why they matter, who needs to be the most careful, and what simple swaps can help protect one of the most underappreciated organs in your entire body. So if that sounds useful to you, go ahead and hit that subscribe button right now before we dive in, because I share videos like this every single week, breaking down real, practical health information in plain English. No confusing jargon, no fear-mongering, just the facts explained the way I would explain them to a friend or a family member sitting across the table from me. Now, before we get into the list, I want to set the record straight on something important, because I think a lot of health content out there gets this wrong, and I do not want to be one of those channels that scares you without giving you the full picture. Your kidneys are incredibly resilient organs. They are designed to filter waste, balance fluids, regulate blood pressure, and keep your blood chemistry stable, and they do this around the clock without you ever having to think about it. For most healthy people, eating a slice of pizza or having a soda once in a while is not going to suddenly damage your kidneys. The body is not that fragile. What we are really talking about today is cumulative strain, the kind of slow, repeated pressure that builds up over months and years, especially if you already have risk factors like high blood pressure, diabetes, obesity, a family history of kidney disease, or if you are simply getting older and your kidney function is naturally declining the way it does for all of us over time. So think of this less as a list of forbidden foods and more as a list of foods that deserve your attention. Foods that, when eaten in excess or too frequently, can tip the scales in the wrong direction for people who are already vulnerable. With that said, let's get into the first one, and trust me, this one might surprise you because of just how common it is. Number 1 on our list is processed and packaged foods that are loaded with sodium. I am talking about deli meats, frozen dinners, canned soups, salty snack foods, and instant noodles. Here is why this matters so much. Your kidneys are responsible for regulating the sodium and fluid balance in your body. When you consistently eat foods that are extremely high in sodium, your kidneys have to work overtime to filter out that excess salt, and over time, this can raise your blood pressure. High blood pressure, in turn, is one of the leading causes of kidney damage worldwide, right alongside diabetes. It becomes a vicious cycle because the harder your kidneys have to work, the more stress is placed on the tiny blood vessels inside them, and those blood vessels are incredibly delicate. The tricky part is that a lot of these sodium bombs do not even taste all that salty. A single can of soup or a frozen microwave meal can sometimes contain well over half of your recommended daily sodium intake in one sitting. And most people have no idea because the seasoning is balanced out with sugar or fat to mask just how much salt is actually in there. If you want a simple, practical swap, try cooking with fresh herbs, garlic, lemon juice, and spices instead of relying on salt for flavor, and get into the habit of checking nutrition labels, specifically looking at the sodium per serving rather than just trusting how the food tastes on your tongue. Number 2 is red meat, particularly when it is eaten in large quantities on a regular basis. Now, I want to be careful here because this is not me telling you to never eat a steak again. Protein is essential, and your body absolutely needs it. But here is the nuance that often gets lost. When you eat a lot of animal protein, especially red meat, your kidneys have to filter out more nitrogen waste byproducts like urea and creatinine. For someone with healthy kidneys, this is generally manageable. But for someone whose kidney function is already reduced, even if they do not know it yet, a high protein load, especially from red meat, can accelerate the decline in kidney function over time. Several studies looking at long-term dietary patterns have found associations between very high red meat consumption and increased risk of declining kidney function, particularly when red meat is the dominant protein source, rather than one part of a varied diet that also includes fish, poultry, legumes, and plant-based proteins. The takeaway here is not fear, it is balance. If red meat is the centerpiece of nearly every meal you eat, it might be worth shifting toward a more varied protein intake, leaning more on fish, beans, lentils, and poultry, while still enjoying red meat occasionally as part of the mix, rather than the foundation of every plate. Number 3, and this one tends to catch people off guard, is dark colas and many dark sodas. The reason these make the list has less to do with the sugar, although that is its own issue we will cover separately, and more to do with phosphorus. Dark colas often contain phosphoric acid, which is added for flavor and to give that signature tangy taste. The problem is that this type of phosphorus, the kind added during food processing, is absorbed by your body far more efficiently than the natural phosphorus found in whole foods like meat, dairy, or beans. For people with healthy kidneys, the body can usually handle this extra phosphorus load just fine. But for people with reduced kidney function, phosphorus can build up in the bloodstream because the kidneys are no longer able to filter it out efficiently. And elevated phosphorus levels have been linked to weakened bones and even cardiovascular complications in people with chronic kidney disease. If you are someone who drinks dark soda daily, multiple cans a day, this is worth paying attention to. Not because one can will hurt you, but because that steady daily intake adds up significantly over the years. A simple swap here is sparkling water with a splash of fresh fruit juice or a few slices of citrus, which gives you that fizzy, flavorful experience without the phosphoric acid load. Number 4 on the list is sugary drinks more broadly, including regular soda, sweetened fruit juices, and energy drinks. This connects back to something I mentioned earlier, which is that diabetes is one of the top 2 causes of kidney disease globally, alongside high blood pressure. When you regularly consume large amounts of added sugar, your body has to produce more insulin to manage your blood sugar levels. And over years of repeated sugar spikes, this can contribute to insulin resistance and eventually type 2 diabetes in people who are predisposed to it. Once blood sugar becomes consistently elevated, it begins to damage the tiny blood vessels throughout your body, including the intricate filtering structures inside your kidneys called nephrons. This is why people with long-standing, poorly controlled diabetes often develop a condition called diabetic nephropathy, which is one of the most common reasons people eventually need dialysis. The kidneys are essentially tiny filtration systems built from millions of microscopic blood vessels, and high sugar levels over time can scar and damage those vessels, just like rust slowly corroding a pipe. If you find yourself drinking sugary beverages daily, even something as simple as switching half of those drinks to water or unsweetened tea can meaningfully reduce your overall sugar burden over the course of a year. Number 5 is something that surprises almost everyone the first time they hear it, and that is excessive consumption of certain energy drinks and supplements containing high doses of vitamins and herbal extracts, particularly when people stack multiple products together without realizing the cumulative dose. Many energy drinks and pre-workout supplements contain extremely high concentrations of vitamin B, taurine, caffeine, and sometimes herbal compounds whose long-term safety in high doses has not been thoroughly studied. While your kidneys are excellent at filtering out water-soluble vitamins like B vitamins, when you are consuming several energy drinks a day combined with separate vitamin supplements, you can end up with an accumulation effect, especially if you are not drinking enough water alongside them, which is common because caffeine itself has a mild dehydrating effect. Dehydration combined with a high solute load is genuinely taxing on the kidneys because your kidneys need adequate water volume to properly dilute and flush out waste products. If you regularly rely on energy drinks to get through your day, try to pair each one with an equal or greater amount of plain water, and consider whether you really need more than one a day, because the cumulative strain from caffeine, sugar, and additives, combined with poor hydration, is a far more common everyday kidney stressor than people realize. Number 6 is excessive salt from condiments and sauces that people do not always think of as salty. Things like soy sauce, certain salad dressings, ketchup, and barbecue sauce. I want to highlight this separately from the processed food category because so many people believe they are eating healthy, maybe a grilled chicken breast with a side salad, while drowning that same meal in condiments that are absolutely packed with sodium. A single tablespoon of soy sauce can contain a significant chunk of your daily recommended sodium intake, and most people use far more than a tablespoon. This hidden sodium adds up quickly and is one of the sneakiest contributors to high blood pressure, which, as we discussed, is directly tied to kidney health over the long run. The fix here is not to eliminate flavor from your meals, because nobody wants to eat bland food forever, but rather to become more aware of portion sizes with condiments and to explore lower sodium alternatives, many of which are widely available now and taste remarkably similar to their full sodium counterparts. Number 7 is alcohol, and specifically the pattern of regular heavy drinking rather than the occasional drink with dinner. Your kidneys play a crucial role in filtering alcohol and its byproducts out of your bloodstream, and chronic heavy alcohol use has been associated with both direct kidney stress and indirect kidney stress through liver damage, since the kidneys and liver work closely together in detoxification processes. Alcohol also has a diuretic effect, meaning it causes you to lose fluid through increased urination. And this can lead to dehydration, which, as we covered earlier, makes it harder for your kidneys to do their filtering job efficiently. Beyond that, heavy drinking is strongly associated with elevated blood pressure over time, and we already know how closely tied high blood pressure is to kidney health. This does not mean an occasional glass of wine is going to harm you. The research on moderate drinking and kidney health is actually quite mixed, with some studies even showing neutral or modestly protective associations at very low levels of consumption. The real concern lies with frequent heavy drinking, binge drinking patterns, and combining alcohol with dehydration or other kidney stressors on this list. Number 8 is excessive intake of certain high oxalate foods, particularly when eaten in very large quantities without adequate hydration. Foods like spinach, beet greens, and certain nuts contain naturally occurring oxalates. And in people who are prone to kidney stones, a diet extremely high in these foods, especially combined with low fluid intake, can contribute to the formation of calcium oxalate stones, which are the most common type of kidney stone. I want to be very clear that this does not mean spinach is bad for you. Spinach is an incredibly nutritious vegetable, filled with iron, vitamins, and fiber, and for the vast majority of people, eating spinach regularly poses no risk whatsoever. The concern is specifically for individuals who have a personal or family history of kidney stones, where moderating extremely high oxalate foods and pairing them with calcium-rich foods, which actually helps bind oxalate in the digestive tract before it reaches the kidneys, along with staying well hydrated, can meaningfully reduce stone recurrence risk. Number 9, and this is the one I want you to really pay attention to because it ties everything else together, is excessive reliance on over-the-counter pain relievers, specifically non-steroidal anti-inflammatory drugs, commonly known as NSAIDs, which include ibuprofen and naproxen. Now, I know this is not technically a food, but I am including it because so many people consume these medications as routinely as they consume food, popping a couple of pills for a headache, sore muscles, or minor aches without ever thinking twice. These medications work by reducing certain compounds in your body that, among other things, help maintain healthy blood flow to your kidneys. When taken occasionally and at recommended doses, this is generally not a problem for someone with healthy kidneys. But when these medications are taken frequently, at high doses, or over long stretches of time, especially in people who are already dehydrated, elderly, or have underlying kidney or heart conditions, they can reduce blood flow to the kidneys enough to cause measurable damage, a condition doctors sometimes refer to as analgesic nephropathy. This is honestly one of the most under-recognized risks out there because these medications are sold without a prescription and feel completely harmless to most people. If you find yourself reaching for ibuprofen multiple times a week for chronic pain, that is genuinely a conversation worth having with your doctor, because there may be safer long-term options or underlying causes of that pain that deserve attention. So now that we have gone through all 9, let's talk about who really needs to pay the closest attention to this list. If you have diabetes, high blood pressure, are over the age of 60, have a family history of kidney disease, or have ever been told you have reduced kidney function on a blood test, these foods deserve a little extra caution in your daily choices. If you are a generally healthy adult with no underlying conditions, the goal is not perfection or paranoia. It is simply awareness, because small, consistent choices made over years and decades are what ultimately shape your long-term health far more than any single meal ever could. Your kidneys filter somewhere around 50 gallons of blood every single day, working silently in the background of your life, and giving them just a little bit of consideration in your everyday food choices is one of the most underrated forms of self-care you can practice. If there is one thing I want you to walk away with from this video, it is this. You do not need to overhaul your entire diet overnight or eliminate every food on this list forever. That kind of drastic change rarely sticks anyway. What actually works, based on what we see in long-term health outcomes, is gradual, sustainable adjustment. Maybe this week you start reading sodium labels a little more carefully. Maybe next month you swap one sugary drink a day for water. Maybe you start asking your doctor about your kidney function numbers at your next checkup, because these are simple blood and urine tests that most people never think to ask about until something is already wrong. Prevention is always easier, cheaper, and less stressful than treatment, and your kidneys, more than almost any other organ in your body, are remarkably good at healing and adapting when you give them the chance. Before you go, I want to ask you something. Out of these 9 foods, which one genuinely surprised you the most? Was it the dark soda and phosphorus connection? The hidden sodium in soy sauce, or maybe the over-the-counter pain reliever risk that most people never even consider? Drop a comment down below and let me know, because I read every single one, and honestly, some of the best topics for future videos come directly from questions and stories you all share with me in the comments. If you found this information valuable, and I genuinely believe it could help someone in your life, whether that is a parent, a grandparent, or a friend who might not know about these everyday risks, please take a moment to share this video with them. You never know whose health might benefit from a 5-minute conversation sparked by something they saw here today. And if you have not already subscribed, now is the perfect time, because next week I am breaking down a topic that ties directly into everything we discussed today. The early warning signs your body gives you long before any major organ problem shows up on a test. Signs that most people brush off as normal aging or simple tiredness. You do not want to miss that one. Until then, take care of yourself. Take care of those silent, hard-working organs inside you, and I will see you in the next video. This has been Dr. Bennett, and as always, stay healthy, stay informed, and I will talk to you soon.